Good morning, everyone. I'm Megan Cullop, along here with Scott Micklin.
Hello. Good morning once
Hi.
again, everybody. Hi, Megan.
Hi, Scott.
Gotta wait for those drums, though. You can't start before the drums.
I know, sorry.
Right?
I rushed the start. I was
No,
just super
you did.
excited.
You're perfect. I know. But you were excited to start the show. It's Thursday, April 23rd. This is our Community Information COVID-19 show from KSJE. And again, we like to promote our radio partners, KNMI, who's also airing the show at noon every day. KSJE Radio airs it at 5:06, and we're streaming it live at 9 o'clock in the morning.
That's right.
So there you go.
So here we are.
Here we are. We got a lot of things going on today.
We got a lot of things going on.
Busy show. We're going to talk to some pediatricians.
Yes.
A little
love
bit about that, right? We're going to turn this into like a Tonight Show.
Johnny Carson show?
Johnny Carson
What
throwback.
could go wrong? We're bringing in a live bird.
A live bird. Not really to the studio, though.
But
it's
still.
going to be through
I know.
social distancing,
Right.
physical distancing.
Right.
But fingers crossed that we get the technology figured out.
I was going to say it's double dangerous because it's a live bird on Zoom.
Right. But we're hoping.
Which seems very birdy to say. Don't they zoom around?
Yeah. Thanks for that.
Yep.
Okay, very
Cool.
good. And we have a person on the
Great.
phones already.
Great.
Who couldn't wait to get on the show.
Yeah, they called before we started.
So there you go. And we're going to go to the phones right now because Devin Neely from San Juan County is standing by. Good morning, Devin Neely. Good morning, Devin Neely.
Can you hear me?
Yes, we can now. Can you hear us?
Can you hear me now? I can hear you. Can you hear me?
We hear you perfectly. And we could have heard you before if I'd pushed the right button. So everything's fine.
Well, great, Scott and Megan. I'm glad to be with you this morning. I hope you're both doing well. I'll be looking forward to Stupid Human Tricks a little bit later on the Late Late Show.
Yes.
But
What's going on with San Juan County today?
Well, I wanted to let you know that San Juan County is partnering with the state of New Mexico to bring a COVID-19 testing clinic to McGee Park this coming Sunday and Monday, April 26th and 27th, from 10 a.m. to 2 p.m. Now, this testing clinic is going to be free of charge. It is intended for folks experiencing symptoms, essential workers with or without symptoms, people with or without symptoms who are contacts or household members of folks who are sick, employees and residents of congregate settings, and anyone who may have traveled to an area with community spread in the last 14 days. So this is kind of exciting. You know, we have some additional testing capacity coming to our area, and we're really hoping that a lot of folks can take advantage of that. Again, Sunday the 26th and Monday the 27th from 10 a.m. until 2 p.m. at McGee Park.
Excellent. Very good. And this is for, you said Sunday and Monday. Are there plans to maybe expand on that, or we'll see how this goes, or how much of a demand there is? What's the thoughts behind that?
Those are great questions, to which I don't have an answer for you right now.
Okay. Well, that's all right. This is new.
But, yeah, this is new. This is just solidified yesterday, and we wanted to make sure that information was out to you folks this morning. And I'll have some more information in an email to you in a little while. But wanted to make sure that was on the program this morning, Scott. So Sunday and Monday, 10 o'clock until 2, McGee Park for COVID-19 testing. Anybody can come, and it'll be a drive-through clinic like many of them have been. You won't even get out of your vehicle, and that is provided by our friends at the New Mexico Department of Health.
Great. So you said anybody can come. Are there any, shouldn't we put like some sort of boundary around that? Or I'm a little worried we're going to have an influx of like whoever is interested. But
well, again, this is intended for folks that have symptoms, any essential workers with or without symptoms. So if you're working at a grocery store or something like that and want to get tested, you have that opportunity. If you're in a household with contact, if you're in a congregate setting, if you've been traveling recently, you're right, maybe not anyone and everyone, but within those testing parameters, there are a lot more people that should be tested now, and that's part of the goal of the state of New Mexico is to expand that testing capacity because, you know, like they used to say, the more you know, and in this case, the more people are tested, the more people the better data we have about that community spread in our area.
Yes, that's great.
That's true. Okay. So good to know, Devin Neely. Thank you for sharing that information with us. And again, do we know when the results will be back for these folks? How long they'll have to wait to know what the test results are?
So that is something else I don't have in front of me. Let me check another email here and see if I can clear that up before I get off the phone. But
okay, sorry to put you on the spot. Sorry to put you on the
I should
spot.
have had that information up. I'm sorry I slacked off, Scott.
That's okay.
We are glad that the Department of Health is partnering with us to make this option available for folks up here. You know, we already have testing clinics through San Juan Regional Medical Center, and they've continued those external assessment clinics, and those are very valuable.
Right.
We hope
well, and
also.
Sure. And while you're looking for that, Devin, I can talk to Megan a little bit about, we talked about testing here. We've had some guests on talking about testing and why it's so important to be able to get a handle on the numbers and the outbreaks and the hot spots and where they are. And because so many folks can be walking around asymptomatic, you may have tested positive, don't know it because you haven't had a test yet,
right?
And now you're spreading it maybe to other folks unknowingly,
right? And
so the more we know about our own cells and our own community, that would be better for tracking this.
Tracking it, yeah, and that would be and I'm sure that, I mean, of course they have a plan for follow-up, but, say I tested positive, I'm asymptomatic, I self-isolate even more for 14 days, I still don't have symptoms, then what's the follow-up? Is it definitely make sure you wear a mask, definitely don't go out? So I'm assuming that I'm sure they've thought that out.
Yes.
I just have never tested positive, which is great.
That's good. Stay that way.
I know, right?
Please.
We want to keep it that way.
Devin, any luck on results?
No,
okay.
We're seeing results back in a few days, and I think it's up to a week in some cases, depending on the volume of tests that come in. But there are a lot of partners who have gotten with the Department of Health that are able to perform that testing. So I know there is a great capacity here. What this does say, though, is while you're waiting for test results, it is important that you continue social distancing, cover your mouth and nose with a cloth face cover when you're around others, wash your hands, and all those things that we've been doing already. But if you get tested, it's important to continue that until you get the test results back.
Okay.
Great.
Very good. Well, Devin, thank you for sharing that good, I would say good news, because, again, we've been talking about increasing testing capacity, so that's great to know. And, again, the times again on Sunday and Monday at McGee Park?
10 o'clock until 2 on Sunday, April 26th, and Monday, April 27th out at McGee Park, and there will be quite a bit of signage and traffic control out there. Obviously, we have a lot of wide open spaces at McGee Park to line vehicles up. We're going to make it as easy as possible for you to get in and get out, and we appreciate all the folks that are taking all of these precautions seriously, that are taking care of themselves and each other, and we really appreciate all the folks that are staying home right now to slow the spread of coronavirus in our area.
Right.
Gotcha, Devin. Cool. Well, thank you for calling in and sharing that with us.
Yeah, certainly. Thank you so much for your time, Megan and Scott, and y'all stay well, stay safe, and stay home.
You too.
Thank you.
Thank you, Megan. Thank you, Megan, and thank you, Devin.
Yeah, exactly.
So, somebody whose name ends in an N, thank you. So there you go.
There you go.
Oh, my gosh.
I know.
I'm not sure where that came from.
That's okay. That's okay. I'm happy that you're producing more bloopers today. Normally, I feel like it's flipped.
I know.
So thank you for...
I'm not sure I like that.
Thanks for evening it out.
That's right. That's true.
Thanks. Yeah.
Well,
So we have somebody exciting on the phone.
Not on the phone. They're actually on Zoom.
Right. The phone video. The video phone.
Alrighty.
The virtual conferencing platform.
I'm going to work on trying to get this.
Yes. So, and I'll introduce it. So,
right. I'm just trying to...
In Aztec, there is a association called Wild Raptor, and not raptor as in Jurassic Park raptor, but as in birds. And so here he is. We're queuing him up right now. He'll explain more.
We're getting there, Mike. Stand by. But he is there, and I think we are just about ready to bring him in. And Mike Photo from Raptors Wild is joining us. How about that? So let's see if this works here. Mike, can you hear us all right?
Can hear you.
All right. We can hear you and see you, and you have a friend with you. And tell us who that is.
This is one of the birds that we have in our education shows that we do. Her name is Spooky. She is a 1-year-old Eurasian eagle owl. That is, we use her in our show to talk to people about the different biological aspects of with owls in general.
Awesome.
We also have falcons, hawks, sometimes eagles in our programs.
Right. And of course, you work with Raptors Wild, and so that is what you do, is through these shows throughout the community during the year. And of course, with what's been going on, those have had to be changed a little bit. So you're appearing kind of physically distant from us this morning, but Spooky goes out with you, and she looks. It's she or he? I'm sorry.
It's a female.
Female. It's she. She's very
pretty.
Yeah,
Scott.
she is.
Yeah.
And she seems to love the camera, and the camera loves her.
I'm like, you should see my smile right now, Mike. I'm like, I love this right now. And so I invited Mike on because he's doing programs, he's setting up programs for nursing homes. And, I've talked to a lot of people who have relatives in assisted living and nursing home, and it's very difficult because right now people cannot go in person to visit. And so
right.
it takes a real hit on people's morale. So, Mike, you want to talk about that? Because I think what you're doing is lovely. So share more about that.
Yeah, what we decided to do, one of the things with the shutdown is, of course, most of the programs that we put on are for groups, like schools. Last summer, we were in Durango at the fairgrounds. We did 63 shows last summer, where they're all educational programs. But of course, because everything is shut down for group activities, we decided that, the people in the nursing homes and assisted living, they're pretty much confined to their rooms. And so we thought they've got to be getting as bored as we are. And we know we can't go into the nursing homes right now. So what we decided to do is we are going to, that was all the casting, we are going to put on take some birds out, be outside of the nursing home, outside of the residents' windows, and we'll be probably on Zoom or some other type of app where they can hear us on their phone. They can see us right up. We'll be right up at the windows, and we'll bring out some birds and talk about those birds. And we're not charging anything for it. It's just something that kind of help them to, give them something to do. And it helps our birds because when we're not active in our programs, then our birds, they're trained to do certain things on the programs, and so they need to constantly be handled, and it helps them to maintain the training that they have. Spooky, for instance, she needs to be handled and
she's talking.
She's talking. Yeah.
So she stays,
sure,
within training.
Right.
So,
because I'm sure normally she's not hanging out in the house with you all the time, like today.
No, she doesn't hang out in the house with me. She is very tame. She's, I've been doing this for over 40 years, and I've had dozens and dozens and dozens of different types of birds of prey. And she's one of my favorites because she is such a sweetheart. And when we're doing our shows, she's probably the most popular bird that we bring out because of her size.
Well, right.
She's a Eurasian eagle owl from up around Russia, and these are the largest owls in the world. And so she gives when we bring her out, she has about a 6-foot wingspan, and she has feet the size of an eagle seat.
Oops, I think she's going to...
There's
the wingspan. Now we see it.
Yeah.
And the feet.
Yeah.
And everything.
Wow.
So she gives a great example of the size of the Eurasian eagle owl, but
you bet.
She's just one of the birds that we use.
Well, and I was just going to say, I mean, it's genius to go out with these animals because of their size, right?
Yeah.
So even if you're standing outside the window, people can see what you're talking about, and you can show them off. So that's really cool. And so, how many animals will you be taking with you to these shows? Does it just depend on the situation, I suppose?
It does, and we'll probably take 4 or 5 different birds, and we'll alternate them. We've done a lot of shows in nursing homes before, and the guests always love the birds. I mean, everybody loves seeing these birds up close. And although we're not going to be able to be inside, I think it'll have a pretty good impact.
Yes, I know. Sure. I know it will for sure. Yeah, I mean, it's so unique. And how often do you get to see? I mean, a 6-foot wingspan is cool enough, and I'm not even stuck in a nursing home, so I think it's going to be great.
Right. I agree. I think it's wonderful. Well, Mike, thank you for joining us. And again, it is Raptors Wild. I know you've got a Facebook page if folks want to check out more of you and your birds and what you do, right, when you're able to go and do it.
Yep, they can go to raptorswild.org for our website. One of the things that we're doing too is that we're trying to get out information to the public that companies like ours that are nonprofit organizations, they're all over the country and they are all suffering greatly right now because wildlife education programs are almost solely funded by donations or by attendance to the programs, the fees that they charge for the programs. And so these companies are still having to pay to feed all of those birds for the programs. And for instance, with our birds, we have about 20 birds, and it's about $1,000 a month that we have to pay for food. Now, we have food stores from last year still, but there are companies all across the country that do this, and these education programs are very, very important because it gives people up close and personal experience with these animals, and it puts an image into their mind, especially children, that is not easily removed, and they will remember this for their lifetime. So these programs are very important to continue to do. So people all over the country need to realize that they need to help support these organizations so that they can continue to put on these educational programs.
I think that's exactly right. Well, Mike, I hope that they will, and hopefully by being with us this morning, we get you a few more folks looking at what you do, and they can figure it out and help you in some way. And I know there's ways to do that through your website and Facebook page, right? So that's great.
Yes.
Perfect.
Great.
Well, very good. Well, thank you for joining us this morning, and thanks Spooky for us.
Thank you, guys. I really appreciate it.
You're very welcome. Take care. That is Mike Photo from Raptors Wild and Spooky joining us here on the KSJ.
Oh
you got to give
gosh.
equal credit to Spooky, right?
You do. What a beautiful creature, right?
And Spooky.
Right. Sure.
Yeah.
Yeah, that's a good point. That's a good point.
Sorry.
Yeah.
I had to,
sure. Yeah.
Okay.
They're known for their wisdom, right? So.
And Spooky.
Oh my gosh.
Yeah.
I think there's another caller.
Yeah, I think there is
There's
too.
another caller?
I think there is too.
Okay, thank God.
Okay. Good morning. You're on KSJE.
Good morning. This is Andrea Pena from Child Haven.
Hi, Andrea Pena from Child Haven. How are you?
Doing well, thank you. I'm loving the jokes this morning, Scott.
Okay. All right. Well, thank you. That makes one of you.
Yeah. Thanks.
Yeah, but appreciate the support, Andrea.
Of course. I have to comment on the new theme song. It's great.
Okay.
Thank you. Thank you,
There you
Andrea.
go.
See?
Okay.
All right. Cool.
All right.
Cool.
I have been
Well,
outvoted on the theme
I was
song
gonna say-
topic. I'm okay with admitting that.
Well, thanks. Now that you buttered us up here,
Yeah,
what's
going-
new?
what's
What's
going
new?
on?
Well, it's one of those things where there's not a lot of new things to talk about as far as, things that have changed because we've all been quarantined for, what's it been now, 41 days?
Yeah, it's going to go on 6 weeks. Yeah.
Okay, I'm just not going to think about that part. I will think about the good things happening at Child Haven, though,
Great.
so I can share some of those.
Perfect.
Some of those things. So I think the last time I called in, we were deciding on what we were going to do with our event,
Yes.
and so we decided to change it from a community festival where we can meet in person to an online celebration. So it'll be on Facebook Live May 1st at 7 p.m. We're also going to go forward with planting 784 pinwheels. We're now going to do it at the Child Haven property. That symbolizes the number of children we served in 2019. So we want to do that to just recognize the hope given to those lives, as well as a way for us to recognize our sponsorships for this year's fundraiser, since we can't do it in the ways we normally would have at an event. So we hope that people will drive by Apache next week. We're still determining exactly how long we'll leave them up for, but definitely next Friday. We just hope people can come by and see that display.
Very nice.
Yeah.
Cool. And I know our very own Megan Cullip is involved with this event on May the 1st,
Yes.
correct?
Yes, Megan, we're so thankful that you're willing to help us out with that. We're excited for the program that we'll have. So, of course, Megan will bring a lot of life to that. And we also have shelter.
Oh, you don't even know how much life she will bring to that event.
What am I going to do when I don't have my handler, Scott Micklin?
You don't even know what a full-time job it is just sitting in the same studio with her. But okay.
I'm looking forward to it. I really am.
So good luck to you, Andrea.
Thank you, Scott. You'll be missed, Scott.
It's okay.
You can tune in though and watch. The show.
Oh, you better. I wouldn't miss it.
Good. I saw someone mentioning Greg Allen is going to be doing the videography for us. So
Excellent.
We're really thankful for him doing that.
Very good. Well, that sounds like a great event, and of course, this event has kind of evolved and changed over time. A lot of folks remember More the Merrier bike ride and things like that have happened, and the party in the park, and so it just grows with the time. But the most important thing is it's still a way to support the work of Child Haven and the Child Haven Foundation in the community, which does so many great things.
Exactly, and I really want to emphasize the importance of recognizing organizations like Child Haven right now who are continuing work. So we are continuing each of our services. Obviously, some things have had to change. For example, like our CASA program, the CASAs are needing to call in with the children, but they're still following their cases. At the shelter, we still have children residing there, and they've been doing a great job of doing projects with them, helping them keep up on their schoolwork. I really need to give a shout out to some local restaurants who have been donating food to us just to kind of help keep things going, and we've had to change up things with staff and our cook just due to their own personal needs during this time. So we have a great community. We're so thankful for it. And then, as you look towards the future, and, I work for the foundation, I'm really passionate about educating people on the fact that Child Haven needs to continue. And right now we're seeing a decreased number of child abuse reporting. That does not mean that child abuse is not happening. It means that there's a lot of kids that are going under the radar right now, and things are happening to them, and we're going to be finding out about them in the future. And so we're ready now to take on those cases. But it's heartbreaking to know that this is happening at teachers and people at their local sports and kids clubs are not able to see them in the same way. So we're working on a campaign to educate people on how to report, and just knowing that Child Haven is ready to serve those children when the time comes, and even now.
Yeah, that's really important. And I think another service that you forgot to mention that I think is really important are the parenting classes, and the counseling for kids and families is still continuing virtually as well. So I just wanted to give a shout out to that, because that's one of those services in the community that's no cost because of the foundation and because of generous givers, right?
So yeah, the whole organization of Child Haven, each program is supporting each other, and when we think about the parent education program, that is for anybody in the community. And let's just be realistic to those of us, which should be most of us, all of us, who've been home and having to handle stress in a different way because of job situations and kids' schoolwork. It's difficult, and for any family, support would be a huge, huge thing. So please feel free to, this would be to the audience members, please feel free to reach out to our Child Haven Parent Education Program if you're looking for some ideas on how to manage some things. We're here to support you, the community. And so we welcome new clients for our parent education class. They are doing that all online, and you can start that class even now. So the phone number to call is 325-5358.
Very good. 325-5358.
Yes.
All right. Well, Andrea, thank you for calling in to let us know about this event. And gosh, this is May 1st, which is already next week already.
Yeah.
Seriously.
Holy, right?
Yeah. We should talk about that, Andrea.
Yeah, you guys should have a meeting.
Yeah.
Later, Megan.
Yeah.
Later.
There you go.
Anyway, thank you both, and enjoy the rest of your day.
You too. Thank you, Andrea Pena.
Okay.
Doing great things with the Child Haven Foundation. And of course, what else can you say about Child Haven? It's a great job in the community.
Yeah.
So
protecting our kiddos and
Yeah,
families. Yeah.
so that'll be great. And you'll enjoy that. You'll have fun with that.
Oh my gosh.
You're looking
so
forward
much
to it,
fun.
right?
Yeah, exactly.
I know.
So looking forward to it.
There you go. All right, so I want to show
Great.
you numbers, and
Yes.
then I want to hear from our doctors.
Our docs, yeah.
Okay, so if you could just talk for a minute.
Ooh.
I know. Well, I do that over
Okay.
here.
let me
Right.
just think about this.
Yeah. Well, we talked about, Devin Neely was calling in talking about
test is
testing.
huge. Test is huge.
And testing
because
should help the numbers, I think, or at least help us interpret the
testing
numbers.
will help us with the numbers and with interpreting the numbers. Testing will also help us with the timeline of when we can start the process, which will be a process of returning to normalcy.
Right.
The testing is key. I think that's what you keep hearing is until we can test more people, we just don't
That's
know
right.
enough to do that. So
Well, and as we talked to the lieutenant governor yesterday, we asked about
Yeah.
that kind of discrepancy in the testing, like percentages,
Yeah.
the per capita testing. And, we saw places like Albuquerque and Santa Fe have a lot of tests, and so they've been testing a lot more of their people than we have up here, and yet
Right.
we have more cases up here. So
Right.
this may help us to, again, understand
yes.
what's going on. So, all right. Thank you for that. That was great.
Yeah, thanks.
Yeah, you're welcome.
Filler.
There you go.
They call me the filler.
There you are. So here we are, everybody, from yesterday. So up 139 new cases. That's one of the biggest increases from day to day. San Juan County, about another 25. So we're getting, I think, on average, about 20 or so
Seems like
new
it.
cases per day
Seems like it.
up here. 6 new deaths yesterday in our state, and of those 6, 5 were here.
That
5
is-
were in San
that
Juan
is-
County.
Yeah, that's a
And so again, yeah, and we can scroll down. Again, this is from our website at ksje.com. This information is coming from the New Mexico Health Department. We always, again, if you want to know where we're getting stuff from, we always tell you where stuff's coming from, the sources of all this information. So if we click on the story over here, everybody, you can see the daily statistics, and that kind of gives us an idea of the folks who passed away, especially here in San Juan County. We wanted to share that with everybody. But if you look at it, female in her 90s, a woman in her 80s, another woman in her 80s, a man in his 60s are the other folks who were the victims and who passed away. So that's the numbers from yesterday from that story. And then I also want to go up and go back to show you some of the other stories that came in. The Navajo Nation, we mentioned, of course, is continuing their cases, and they are, again, kind of changing the numbers from how they were reporting earlier by just looking at Navajo Nation residents who live on the reservation. I guess that's what they're
Right,
doing. They
right.
took out the numbers from the border towns.
which is huge. That's really helpful.
But they still had 76 new cases yesterday,
Which is also
and
huge.
1 death across the Navajo Nation. So they are continuing their curfews on the weekends.
Yeah.
They're continuing their stay-at-home order, I know. We'll get a story up there about that. And and then again, we saw 4 new cases in Montezuma County. Now, that is from their last reporting, which was about 10 days ago. So that's only 4 cases over 10 days is what that's showing.
Gotcha. Okay.
And no new deaths in Montezuma County, which
Okay.
is Cortez area.
Gotcha.
So there you go.
Wow.
Everyone.
Okay.
Right?
Yeah.
Okay. So let's
All right.
hear
Still
from our
surging.
doctors.
Yes, let's talk about this issue from the perspective of a medical doctor.
Okay.
Yeah.
Let's see what we got here. Joining us now to talk a little bit about how their office is responding to the COVID-19 pandemic. Dr. Preston Harrington is joining us via Zoom this morning. Dr. Harrington, nice to see you. Good morning.
Good morning.
Thank you for being here. You are with San Juan Health Partners Pediatrics, of course. Also, Shailene Brown is going to be joining us, or is joining us as well, the Pediatric Clinic Director. And Shailene, good morning to you.
Good morning.
Thank you for being here as well. Great to have you both with us. And we've got some questions to ask you a little bit about some of the things that you are now doing at the clinic. So, Megan, you want to start?
I do want to start.
Okay.
We're gonna start with teledoc, I believe.
Well, let's do it.
Seeing patients on video. So,
Right.
Yeah.
That has changed a little bit. So talk to us a little bit about how that works at all of your clinics, I guess, right?
That's correct. So in an effort to continue to meet our patient needs with those essential visits, we developed some virtual visits. So those virtual visits can be completed through a telephone or through video if we're able to. And so those visits can be done at any of our San Juan Health Partners family practice, primary care, pediatric, our urology offices, neurology, even our spine center has the ability to do these video visits now.
Now, Dr. Harrington, in thinking through these video visits, I'm sure that there are some disorders where patients need to be touched or examined that way. So how does that work? You know, if you got to look in somebody's ear, down somebody's throat, how does that work?
Good question. So what we typically do is we're doing well visits for babies under 2. We have to do those in person because we give vaccines. And then for other visits, they will start with a video visit typically, although each of us providers will be looking over our schedule, and if we can spot that a particular condition or particular situation needs to be seen in person, then we will direct them to come in and be seen in person. Or sometimes I've had one episode where I started as a video visit and it just wasn't working and I couldn't get what I needed, and so then we defaulted to an in-person visit. But by and large, the patients are very appreciative not to have to come out during this pandemic, and I would say 90% of what we do, we can do just by talking to you. And let's say you have asthma, and we're asking how much are you coughing at night? Are you having symptoms from the exercise? Which inhalers are you using? Most of that can be done virtually.
Great follow-up. Scott, I believe you have a question about vaccines.
I do have a question about vaccines. I know, Dr. Harrington, we've talked to you and I about vaccines a number of times on this program, and so as we talk about COVID-19 and coronavirus, I know every country, I think, in the world is probably trying to race towards finding a vaccine for this. What are you hearing? I know you stay up to date on some of the medical journals and things along that line, but it takes a long time, doesn't it, to come up with an effective vaccine as quick as we'd like to?
Yeah, I think I'm hearing what everybody else is hearing, that it's probably around 18 months, and that's just a guess. They started, a close relative to this coronavirus was the SARS virus from almost 20 years ago. And so there was research already starting down that path to look for a vaccine for that, and there's close enough similarity that may allow us the researchers to piggyback onto that and not start from scratch. There's actually no guarantee that you'll find a vaccine that works. We've had other viruses like RSV that have been around for 50 years or more, and we've yet to come up with a successful vaccine. So we're kind of banking on that, and there's tons of money and tons of energy going into it, but there's no guarantee that we'll have a vaccine.
So in the interim, is there also a race to find treatments in the process of looking for a vaccine, especially if, like you said, we don't have a vaccine for some of these diseases we've been looking for a vaccine for. So can you speak to any updates on that?
Yeah, and the information travels fast. So today's update, maybe what I heard last week, and so there may actually be news every week. And you've probably heard that malaria medicine has been around for a long time. There was a lot of hope that was helpful, chloroquine and then hydroxychloroquine, and people were having small reports here and there that they were making a difference. But one of the reasons we have the discipline to not just jump on board when there's basically a rumor like that is that once they looked at larger groups of patients, it turns out that it's not really, that particular medicine is not showing that it's much help. Other medicines that are designed to fight viruses in particular, and I can't remember the name of the most recent one that is maybe showing some promise, but they all tend to end in vir, like remdesivir, something like that. So stay tuned. But by and large, right now, the mainstay of treatment is just taking care of the patient. So if you need oxygen, you get oxygen. If you need help breathing, you get help breathing. If you're dehydrated, you get IV fluids. And so the other treatments may come online probably faster than the vaccine, actually. But again, we don't really know today, I would say. This remdesivir, or I'm sure I'm saying that wrong, may be the most promising one as of today.
Right. Well, and Dr. Harrington, I know we've talked a lot about, we hear a lot about the term herd immunity, and so I suppose as maybe more folks are infected with this and recover from this, that can help the rest of us. Is that true? How does that work again?
Yeah, so that is certainly the hope. So a good example is measles, for example. If you get measles, or like most of us, we got the vaccine and got immune that way, then if a certain portion of the population is immune, even if somebody gets off a plane with measles, it won't spread because there won't be any other enough vulnerable people to let it catch and run. And so that's one of the reasons why the anti-vax movement is so dangerous. We've already seen that in certain populations. If the measles immunity drops to a certain level, then there are enough people in the crowd who can allow it to propagate. So along the same lines, the hope is that once you get this COVID-19 that you will have long-lasting immunity. I would say that's still not known, but if that were true, then gradually as more and more of the population is immune, it would be less risky to go to the store or to go to the restaurant. So you can get to herd immunity in a perfect situation either by catching the virus or by getting a vaccine. I think that's what the optimistic view is, that a couple of years from now, most of the population will be immune because we will have gotten a vaccine. Currently a small proportion of I heard some information that in LA County, maybe 4% or 5% of the people are already immune. You really need to have about 60% of the population to be immune in order to get benefit of the so-called herd immunity, where if enough people around you are immune, then you're relatively protected.
Right, I see it, but it takes time though to develop that, as you're saying, right? So this is not something that's going to happen like this summer, right? I mean, this is going to take years, as you mentioned, and you have to have, it seems like, a vaccine component of this herd immunity idea, right?
Right. The hard way to get herd immunity is to, if you imagine something like Italy, where you just have a disaster and lots of people are dying and the hospitals are overwhelmed, but you come out the other end with a lot of people immune. We would prefer not to do that. That's why we're having the shelter in place and the lockdown, and you can't go to the restaurant to try to not overwhelm our health system. But then it takes a lot longer to build up 60% of the population to be immune, unless you have a vaccine that can sort of leapfrog to that point.
Great. So segueing from the lockdown point, speaking especially because you're in pediatrics, there's a lot of questions about children in the virus and it not seeming to maybe has as large of an effect on children. And so in thinking through schools, I think, traditionally it's you shut down a school and you stop a lot of spread, but is that as effective in this case? And if kids aren't getting infected as much, is it still possible that they'd be passing it on to their parents, and so it'd still be kind of a cesspool of the disease?
I think you're right on. The good news is that kids over 1, from like 1 to 18, are unlikely to get any kind of serious illness. There are exceptions, but if you look at all the curves, the real trouble starts in your 20s on up. So, and the exception is little babies. So if you have a 2-month-old or a 3-month-old, they may be more vulnerable. But kids do catch it and they do spread it. So I think shutting the schools was smart, because if thousands of kids get together and share germs, and they're not that sick themselves, but they take it home, and the rest of us end up on oxygen because of it, that's not a good plan.
Understood. Thank you, Dr. Harrington. And Shailene Brown, let me bring you back into the conversation a little bit about providing some of these televisits and things like that, and working with all the other providers like Dr. Harrington to be able to do that. Was that something that everybody kind of picked up on pretty quickly, or was there a lot of lessons on how to do this with this type of technology? Because I imagine some of this is new to some of your providers.
It is, but the program that we picked is one that's been used in healthcare for quite a while, so it's pretty easy to use. Our challenge as an organization was making sure that we had all of the webcams that we needed. When we started this project, there was hardly any webcams to be found, so our IT department did a great job of ordering those. We had cameras that we were using at the front desk to take patient pictures as they were coming in and being checked in, so we repurposed those. So that was our biggest challenge, was finding webcams. We still have a challenge somewhat with technology on the patient end. If they don't have good cell phone service or internet, then it's sometimes difficult to do the visit that way. We may start a video visit with the patient and then realize, oh, we need to move over to just a telephone visit. And so those are some of our challenges that we've had.
I got you. And that's always an option, I guess, then if you find the connection is just not that stable, you can just cancel that and call back on the phone, and the patient can still get a consultation or a visit with the provider?
That's correct, yes.
That's great. And so again, this is available at all of the San Juan Health Partner clinics, and the folks need to request that, or is it just an automatic
What they'll
televisit?
do is they're just going to call the appointment desk at that clinic like they normally would, and then the determination will be made by the physician or one of our nurse practitioners or PAs on whether or not it's going to be an in-person visit or if it would be a video visit.
Understood. And we keep hearing, of course, from folks at the hospital and others that even though COVID-19 is all over the news these days, people are still getting sick and still having health issues and still need to keep up with visits and just keeping their health, keeping healthy. And that's what we're talking about, right?
Well, and we're trying to keep them out of the EDs and the urgent cares because those folks are going to be overwhelmed. And so with these video visits, we can still meet the New Mexico State public health order, and supply those essential visits to our patients.
Very good. And Dr. Harrington, again, any final words of advice for the rest of us to stay healthy? I mean, are all these recommendations coming from the state and federal governments doing their part, do you think, to keep us as healthy as we can be with all this around us?
Yeah, I think the thing we've been saying for a while still holds, to try not to touch your face. That's a trick for me. I find I touch my face all the time, and to wash your hands frequently. I think we've all seen on social media and stuff people who mistakenly wear a pair of gloves and then they go out shopping and they touch their face and everything with their gloves, and they have a false sense of security with that. So some sort of cloth mask when you're around people is probably good citizenship mostly, so that if you happen to be starting to come down with it, you're not spreading it. But mostly it's hand hygiene and not touching your face, and staying home until it's decided to start to phase back into going back to work and then back to school.
That is good advice. We have a running count here at the show for Megan when she touches her face, so that just is something we follow.
Well,
so.
I'm happy to know that a medical doctor has the same struggle that I do.
There you are. See, something that you all have in common. So terrific.
Yeah.
Well, Dr. Harrington, thank you very much for spending some time with us this morning. We appreciate it very much. Stay well.
You too.
Thank you very much. Shailene Brown, again to you. Thank you very much for spending some time with us, and stay well to you as well.
Thank you, Scott. We appreciate the time.
You're very welcome. Thank you both.
Bye.
And there you go, everybody. Our interview with our local pediatrician. Some good information there.
I love it.
So, for back
You know me. I always love the doc interviews.
I know you love talking to the doctors.
Obsessed.
I know you do. That's true. And we have, I think, maybe a final caller
A final
today.
caller, a big one.
A big final caller, because he's none other than the mayor of Farmington. Mayor Nate Duckett is on the phone. Mayor Duckett, good morning.
It's Scott Micklin, Rock and Rev. You guys are awesome. How are you guys today?
Thank you. Good.
We are well, Mayor, and I like that Rock and Rev.
I know.
Have to use
Isn't
that
he the best?
from time to
I
time.
love it. Thank you.
So there you are. We are well, Mayor. How are you doing?
I'm good.
I wish, Mr. Mayor, you'd come onto your shell a little more on social media. You might get some more comments on some of the things you're proposing.
Hey, it's fun to see people get engaged out there. I made a comment to somebody yesterday that I'm doing my part to keep people at home and engaged on social media, apparently. So
you were doing that, and so again, your proposal that you talked with me about last week here on KSJE to ask the governor if there was a plan to maybe thoughtfully reopen small businesses across our state with a 20% occupancy, and you've gotten a lot of comments from that. The governor's had some things to say about that yesterday, I believe, didn't she?
The governor did. She came out and actually kind of verified some of those things I put in my declaration about a plan, which she provided, that phased and approach plan yesterday. She also included a mayor's council, which was another component of what I'd asked in the declaration, that she consider including local leadership into the discussions about how we're opening up businesses and what we need to do locally, and just allow people renewed focus on where we need to go from here. So she addressed that as well. So those were things I was very happy to see. Of course, we're going to be dealing with Colorado opening on Tuesday, to a small extent, and we're going to have to be aware of what our neighbors are doing around us. I mean, that's 40 minutes from here. Obviously, people are going to want to travel up to that area, and the governor wants for people to stay home. And so I think it's important that she consider places like this in this long-term plan and kind of mirror maybe what Colorado's doing to incentivize New Mexicans to stay in New Mexico. I think if we talk about keeping people where they are at so that they're not spreading the disease, you've got to consider what opportunities exist outside that would make them want to go, and try and maybe include them in what we're doing here inside of our own state line.
Great. And I think it's also important to note, going back to your original declaration and plans and concerns, that part of it was the discrepancy between the big box stores and the small businesses. So I don't want that to get lost. We focused a lot on the opening up to 20% capacity, but it's very important, I think, to not let that point get lost. Why is it that small businesses, small local liquor stores can open up, but Walmart can sell liquor and it's a big box store, or any big box store, not targeting that one specifically. But
I think
I agree. I think a rational person can make a good argument to say that it's safer for me to be in an environment where there's less foot traffic and there's more ability to social distance. And so I think there's a great argument there still. Of course, last week, and this week both, you're going to see here in the community, and I think this is where people are kind of seeing this perception that maybe people here in Farmington don't care because we're so busy in this small section of Main Street. Well, when stimulus checks go out and those checks hit everybody in the Four Corners, and we're the shopping hub for the Four Corners, of course, those 5 stores that are open are going to be busy. I mean, that's just what it's going to be, and it's sad to see that local business didn't have an opportunity to also put forth their best efforts in providing a safe and healthy environment to where locals could shop in those businesses as well. But it is what it is in that situation, and we didn't have any control over that. But I am happy to see that she has made a path forward for us. I think again, it's really critical that people know what to expect and know what they need to do. And so we've already begun working here locally and coming up with a really fun plan in my mind of creating a action plan form for local businesses that kind of lays out these are the health and safety practices that the governor's asking, that your customers are also going to be asking for, to ensure that you're doing everything you can to provide a safe business environment.
Right.
And we're looking at bringing that out and having businesses sign off on it. And make a commitment to it, and maybe doing like a certified sticker or something on their door that says I'm health smart. I'm a health smart business, and just is that added effect of small businesses doing everything they can, because small business owners are passionate about what they do. It's their lifeblood what they do, and they some of these folks have had employees that have worked with them for 20, 30 years, and that's become the lifeblood for those employees and their families. So we really want to engage them and help them through this process of getting back up and operating in a safe environment, so that we don't do what the governor and others are concerned about, and that's spreading the disease, which leads to more infection and potential worse outcomes. So I think we can do it, and I think this gives us an opportunity, just like she laid out yesterday, for us to move forward with it. And so yeah.
And so, Mayor Duckett, it sounds like you're optimistic after the governor's comments yesterday, and it does seem to be maybe a clearer path forward out of some of these more restrictive lockdowns and things like that. Is that the message that I'm hearing from you today?
I'm optimistic about it, Scott. I obviously I didn't want to see the order get extended. It concerns me that Colorado's opening up just north of us. Utah is also opening up, and I'm sure those folks who are up there in their Homeland Security offices in Colorado are concerned about us not opening up. Those things need to be more fluid, and we've got to find a way to address it. I've sent those concerns to the governor. We had a phone call with her prior to her going on air yesterday. It was a very productive phone call, and she recognized the mayors and thanked the mayors and said, I know you guys, I haven't brought you into this conversation, but I'm bringing you into the conversation now. So I think what we initiated last week was a positive step forward in bringing mayors who represent their communities, the health of their communities, the comprehensive health of their communities to the forefront of some of these conversations. We know that the environment here, the economic environment in Farmington and San Juan County, prior to the virus, we were all working hard and hustling, and this virus is going to take its toll on us in many different ways. But we can find balance. And I think what I heard in her message in the end of it all is that she's understanding that, and she recognizes balance is going to be necessary for the long term.
Sure. And Mayor, your your colleague, the mayor of Grants, has kind of announced plans to try to reopen his community maybe a little sooner than some folks would consider. Is that something that you're watching carefully to see what happens there, or do you think that's going to have problems?
Absolutely. Absolutely. I mean, we're watching what's going on. The mayor of Eunice also, they passed a resolution earlier this week to open in the next 2 weeks. So there's a lot of action happening across the state. The southeast part of New Mexico, those mayors are also in the same predicament. They have a lot lower cases in those areas, and they've got Texas opening up. So they're dealing with the same kind of border issue that we are up here, and that there's going to be people traveling back and forth. And that's something that all governors have recognized, that we really need to keep ourselves still kind of safer in our home, is what Colorado's calling it now, mentality, and still limiting our interactions for the next couple weeks. But the governor's given promise that she's going to start easing up on these restrictions on particular businesses. I have provided her my suggestions in that to continue to incentivize New Mexicans to stay here instead of traveling elsewhere. That included this week, the suggestion to open up golf courses and state parks, and then moving even what my declaration stated is that companies that are in direct competition with Walmart, with the Walmarts of the world, be allowed to open with those health and safety guidelines incorporated into their businesses. It's going to be important. Customers are going to want to see it. And I don't know if you guys have gone to Sam's Club, but Sam's Club in the grocery stores, they've done a really good job. I mean, in this kind of environment of ensuring that they're wiping down carts, the people at Sam's Club, I mean, I've heard them yell at customers, "Hey, 6 feet, please."
Yeah,
so,
right. That's good.
So they've taken up the task here, and I know that our local businesses that aren't open right now or have been somewhat shuttered to some degree, I have no doubt that they can do the same things and provide a safe place for people to be.
Very good. And Mayor, one final question for you, and appreciate your time this morning. Your message to the healthcare workers, because I know some of them feel almost personally affronted by when they're working every day to keep people safe and try to get sick folks well. And they're really concerned about this increasing cases if we do some of the things that you propose. And what would be your message to them? I know you've talked to them personally, I think on social media and things like that, but just for folks listening to us today, what's your message to the healthcare workers? Because you've got one in your family.
My wife's a healthcare worker.
Yeah.
And there's healthcare workers who've reached out to me and said thank you. And it's Scott, and it's important if you read the declaration, and maybe what we do next time is we don't put a headline on anything, and so people read through the entire declaration, understand exactly what it says. And in the scope of opening up a local business that is already at 20% capacity, and they're going to maintain, if we said they could only meet 5 or 10 people inside of that business, the suggestion, again, the argument that it's not safer to shop in that business than it is to go to Walmart, I still can stand by that. I mean, we frankly don't know. There's places in town that have been in quarantine and people are still getting infected. So it's going to be with us for a long time. I think healthcare workers understand that better than anybody. Firefighters understand that better than anybody. And it's going to be important that we find and be responsible in our actions from the frontline workers who are doing a fabulous job, and I commend them. And we find those ways to put in the precautions and take the daily actions. And I know it's strenuous, and I know that the PPE is a concern, but I want to make sure people know that we're going to be doing weekly updates with the hospital. Every day the hospital numbers are being posted on Facebook. We're paying very close attention to those things because overrunning our healthcare system is what we don't want to happen. I mean, the virus is going to run its course, but we want to make sure that we've flattened that curve, which the governor talked about yesterday, keeping that curve flat so we don't overrun it. And she said, New Mexicans, you can congratulate yourself on that. Now, obviously, we're in a hot spot up here, and we need to pay attention to it. But I appreciate the work that's being done to continue to move patients throughout the state to ICU units that have more capacity, and we're going to manage this appropriately. I have trust in our healthcare workers and the healthcare system that we're going to get through this. And again, it may come back in the fall, it may come back next year, it may mutate, it may turn into something else, and I don't think we can sit in place and hide and expect to have a healthy community or even be healthy as people. Economics in your household, and you own a household, if you have a strong economic foundation in your household, you normally have better access to health care, you're taking preventative care, you're eating better foods, you're better equipped to deal with sickness. And so all these things go hand in hand when we talk about the comprehensive health of a community. And certainly my wife understands that and appreciates that, and I know many other healthcare workers do as well. So I appreciate the work that they're doing, and know that obviously in making a suggestion to try and consider the comprehensive health of the long term for everybody who lives, works, plays, and stays here is not in any way, shape, or form a smack in the face to what the healthcare workers are trying to do at all.
Very good. Well, Mayor, I appreciate you calling in this morning to share with us your views and an update on what's been going on and your conversations with the governor. I think, again, I'm optimistic, and I think we have a path forward and can't wait. So thank you.
Guys, thanks for doing what you do to keep everybody updated. It's an important component of the communication effort that's being done here throughout the county, and it's vital. So I appreciate the job you're doing.
Thank you.
Thank you very much, Mayor Duckett, Mayor Nate Duckett, Mayor Farmington, our guest here on KSJE, and that's going to wrap up our show today.
What packed show.
We are right
How
at
cool
the
is that?
top of the hour. This is the longest show yet.
This is the longest show yet.
So,
because we
good job, listeners.
Good job, listeners.
You've made it.
It's a marathon, because our pledge to you is to not just ramble on and on.
I don't think we've done that today. We had a lot of really good content today.
We did. We did.
And so, anyway, thank you, everybody.
Birds to mayors to children to doctors.
Right? How about that?
Crazy.
Love it. All right.
Cool.
Anyway, well, we are done, everybody. We'll be back on Monday at 9 a.m. Jeff Bourgeois, CEO of San Juan Regional Medical Center, is booked for Monday's show to give us an update from the hospital's point of view. And we will be back on Monday with you again live at 9 a.m. and a rebroadcast again on the KNMI radio at noon and KSJE radio at 5. So I'm Scott Micklin along with Megan Cullop. Stay safe. Have a safe weekend.